Hello everybody. My name is Nguyen, and I'm a PMP, which is a psychiatric nurse practitioner. I have been doing psychiatry for about 7 years now. I think it's a very important topic, especially when it comes to like postpartum psychosis, depressions, and especially when it comes to women's health. So today, the topic that I want to talk about is postpartum psychosis. I think not a lot of people understand or even know what it is, and they would often get postpartum psychosis and depressions mixed up. So what we want to do today is understanding, recognizing, and treating, and how can we support mom who is suffering from postpartum psychosis. So before I give you all this information about postpartum psychosis, I want to go over a story of Andrea Yates. So this story is gained national attentions in 2001, and what it does is bring awareness and public and legal impact to and highlight a lot of issue around postpartum depressions, postpartum psychosis, and it's bring highlight to the importance of proper mental health treatment for women suffering from these disorder. So Andrea Yates, she was a nurse. Basically, she known for killing her children because of her psychiatric disorder. So after she had her first child, her and her husband noticed that she's not herself anymore, that she's started hearing voices, started having delusions, and she get to see a psychiatrist, and they diagnosed her with postpartum psychosis. And she also suffered from postpartum depressions. And those two are very different, and we're going to talk about it later. However, and they recommend that she stop having children because each episode will only get worse if she continued to have children. However, as a devoted Catholic, her and her family decided that she would have more children. And she did. She eventually had 5 children. She was hospitalized multiple times for her postpartum psychosis and depressions, but not much is being known and not much has been done for her. So eventually on June 20, 2001, against the advice of her psychiatrist, her family left her alone to take care of her children by herself. And this is something that should never happen for a woman suffering from postpartum psychosis, as it's very dangerous, as she may be very suicidal or she want to hurt her children. So that's eventually happened. And she, again, today, she started hearing a lot of voices telling her that she's a bad mom and her children will go to hell, will be condemned forever because of her failure as a mother. So the only way for her to save them was to kill them. So she drowned all of them one by one at home. And of course, she got arrested, charged with murder. And in prison is where she get all her psychiatric treatment. And I think that's an extremely sad case that we can't help women suffering from postpartum psychosis. And the only place that for her to get treatment, proper treatment, I would say, is at a prison. So now if you follow her story, she have gotten way better. She come out of her psychosis state. And now she's quote unquote living a normal life, and she is a what they call a good prisoner. So can you imagine when you come out of your delusional state, your psychosis, knowing that you kill your own children, all the suffering that you may feel after that? So that's why it's so important to recognize and understand what postpartum psychosis is, so your family can help you. So introduction to postpartum psychosis. This is a severe mental illness that usually occurs after having a baby. It's very different from postpartum depressions. So depressions is basically characterized by feeling sad, loneliness, hopelessness, having lack of energy. You don't want to do anything. So for example, if a mom does not want to get up from from her sleep. She doesn't want to do anything. She doesn't want to take care of her baby. She may suffer from postpartum depressions, but if she hear voices having delusional, disorganized thinking, then she's suffering from postpartum psychosis. So it's very critical for us to understand, recognize, and treat postpartum psychosis as this is a psychiatric emergency. We want to support the mom and the family. So we want to bring awareness that can lead to early diagnosis and better outcome for these moms. Instead of them going to prison, we want them to have outpatient care, right? Again, postpartum psychosis, even though I talk about how dangerous it is and how that is a psychiatric emergency, it's an extremely rare condition, but it's very serious. The mom will lose contact with reality. Most of the time, they don't know what they are doing. Only 1 to 2 out every 1,000 mom will have it. Typically, it can occur after 1 week after you have your baby or up to 12 weeks. So now it's dangerous because the mom can be suicidal. So she want to hurt herself. Oh, she want to hurt her baby. So most of these women, they have hallucinations, which is hearing or seeing things that are not there. For example, Andrea Yates. She hears a lot of voices telling her that she's a bad mom. And they may have a lot of delusions. Now, a lot of their delusions will often involve their babies, their children. That's why her delusion or her fixed belief is that she's a bad mom. And if she does not cure her children, they will go to hell and get condemned. So for her to save them, they will have to die, right? A lot of these moms will have severe mood swings. For example, one minute they may be happy, they're doing everything, they're cooking, they're cleaning, being a good mother, and then the next minute they're just sleeping in their bed, they don't want to do anything, they don't want to get up. And they may be confused, a lot of disorientations, difficulty making decisions, difficulty in the thinking process, they can't think clearly. And they may be paranoid. They can't trust other people, they're very suspicious of other people. For example, they even may believe that their baby is not their baby. And a lot of these women, they may have severe insomnia, excessive sleepiness, either or. So it's very for us to know all these informations and look at moms who may be suffering from postpartum psychosis. Some of the risk factors that may trigger postpartum psychosis is the woman may have a history of bipolar disorder or schizophrenia. Those conditions will highly increase your risk of developing postpartum psychosis. Or if you have family history of mental illness because of the genetic component to it, they're also going to increase your risk. And if you have a previous episode of postpartum psychosis, that's almost a guarantee that you will have another episode again. Andrea Yates. That's not her first time. She had been diagnosed with postpartum psychosis ever since the birth of her first child. And if the mom doesn't get a lot of sleep, and now as we know, especially when you have a new baby, you may not get a lot of sleep. You may stay up late at night taking care of your baby. Baby may cry the whole entire day. So if that mom doesn't get that much needed rest or sleep, that can trigger her to get postpartum psychosis. So as family members, they must know to recognize and see if something's going on and help the mom to take care of herself and her baby. Now, as for a diagnosis, only a thorough assessment by a psychiatrist will indicate if a woman have postpartum psychosis. So what we usually look into is maybe if the patients have a history of bipolar disorder. And now if she have a history of bipolar disorder, have she been taking her medications? Have she been complying with her medications? Have she stopped taking her medication before or during her pregnancy? So a lot of bipolar medications like Depakote, lithium, they are very toxic to the baby. So usually a psychiatrist would recommend, if you're planning to have children, planning to get pregnant, you may want to stop taking those medications. But again, one of the risk factor for developing postpartum psychosis is bipolar disorder. So imagine a woman who has bipolar disorder and she stopped taking her medications. So her chance of getting postpartum psychosis just increased significantly because of that. So that's why a thorough assessment is needed. We also want to look into if the woman have any substance abuse, any history of any recent stress in her life aside from having that baby that may trigger her to have postpartum psychosis. And we always want to evaluate her support system. What are her responsibility at home? Does she have to do more than her husband, or does she have to do more than her partner? As you know, I think there's a lot of expectations for women after they have a baby. You gotta get your body back, you gotta get your career straight, you still gotta do what you used to do before you have the baby. They're like, oh, Kim Kardashian, she got her body back after 2 weeks. But a lot of these celebrities that we see on national TV and how they, doing all these amazing stuff after having a baby, that's because they have 24/7 24/7 nannies. They have a personal trainer, and a lot of normal women like us, we don't have that, and we have to take everything by ourselves. We have to take care of our family or newborn babies. So a lot of expectations that society places on women, which can increase our chance of getting postpartum psychosis. And we want to, exceed those expectations. Everybody want to be a good mom. They don't want to be considered to be a bad mom. And as for family member, they wanted to monitor and assess if that woman have been diagnosed with postpartum psychosis. Are her symptoms getting worse? Oh, or she getting better? What's going on? What else can they do to help her? So that continuous observations by family member is very important, because a psychiatrist or an NP may only see the mom maybe once a month or every 2 weeks, but the family member is always there with her, so they need to help with that observation and monitoring. There are a lot of treatment options available. First, we gotta recognize how severe her disorder are. So, for example, if she's feeling suicidal, if she's having thoughts of hurting herself, hurting her child, then hospitalizations is definitely necessary. That's just to make sure that the mom is safe, the child is safe. Now, if the symptom is not that severe, then maybe just managing medications at home. But if she's indicated, I may kill my child, I may kill myself, then hospitalizations and medications combined together are necessary. So when we talk about medications, we talk about antipsychotics medications that will help with the delusions, the hallucinations. Most of the time, I would like to use second generations antipsychotic medications as they have fewer side effects. But if the mom have severe postpartum psychosis, then I would like to go with a first generation's antipsychotic, Haldol, because I think that those are more helpful in treating severe cases. And then mood stabilizer like lithium, these are for women with bipolar disorder. Now you want to go ahead and get them back on track to where they have been stabilized before. So we talk about lithium, Depakote, and of course, therapy is very important. Cognitive behavior therapy. Let them learn how to cope with the new life, with the new stress. And counseling, not only for the mom, but for the family. This is to educate a family, to support the mom, letting them know, educating them about postpartum psychosis, letting them know she's not a bad mom. She's not a lazy mom. This is considered to be a psychiatric disorder, and she needs a lot of support and help. and don't put too much expectations on her. Let her figure out what worked for her and what does not work for her. Like I say, we need to support a mom as an emotional support. A lot of these women need emotional support because a lot of her family member may see her as quote unquote a bad mother. She's not out there taking care of her children. Oh, she's hear voices telling her that she's a bad mom. And then now her family member telling her she's also a bad mom. So a lot of empathy, a lot of reassurance, understanding. And then a lot of practical support. Let her have some rest. Because again, one of the risk factor for postpartum psychosis is lack of sleep. So maybe taking care of that baby for her while she take a little nap. That's extremely helpful. Help her do some chores, make sure she get a lot of rest, and then assist her in going maybe to the doctor, see, making sure that she taking her medications, taking care of that baby for a minute. Let her go see a psychologist. And as I say, family member must help with monitoring the symptom and recognizing any sign that maybe she's getting worse or she's relapsing, right? The outlook is actually really good because with appropriate prom treatment, a lot of these women 100% fully recover. So with antipsychotic medication, they'll come out of their psychosis state. But again, we need to understand and recognize when a woman is developing postpartum psychosis so we can get her the early treatment that she needs before things get worse, before she feels suicidal, before she end up like Andrea Gates and have to be arrested and have to be placed in prison, and before she kill her children. And after, she be on medications, we still gonna continue to support her, let her go counseling. That's very crucial for her ongoing treatment. And as a provider, I always let them know that, if you want to have children in the future, if you are planning any future pregnancy, the chance of you developing postpartum psychosis when you've already been diagnosed with one in the past is extremely high. It's almost a guarantee that you will have it again. And for each pregnancy, it'll only get worse. So letting them know that information beforehand is also very crucial. As I say, you want to go see a psychiatrist, any mom that's suffering from postpartum psychosis, a psychologist and counselor, but not just anyone. You want to see a psychiatrist or a psychologist that are very well equipped, well educated when it comes to postpartum psychosis, because this is an extremely rare case, extremely rare psychiatric emergency. So not a lot of psychiatrists or psychologists know how to treat or are well educated or well equipped in treating postpartum psychosis. The new mom, they may want to join a support group. And also their families may want to join a support group to see what other people are doing that could help them implement in their daily life. And just to let them know they are not the only one that's suffering from this psychiatric disorder. There are other people suffering from it and they are doing well and they are recovering. So that's really good resources and support that they may have there. Just educating themselves about postpartum psychosis, read more about it. And of course, there are always emergency support, crisis helpline if they're relapsing, and if they believe that symptoms getting worse. So basically, in conclusions, we want to recognize and treat postpartum psychosis early, which is very vital for the well-being of the mom and the baby. We don't want another Andrea Gates story. We want mother to know they are supported. There's treatment out there. They are not the only one that's suffering from postpartum psychosis. We all also want to include the family. the support system in their recovery system. That family is very important, especially for women suffering from postpartum psychosis. They need that family support. They need a partner to take on some of the workload for them. And don't expect too much from them. Let them figure out how to be a mom. And then open discussions about maternal health to reduce the stigma, to promote better healthcare, especially in Georgia. As you know, in Georgia, we are place 48 when it comes to mental and psychiatric healthcare. And we are one of the worst state in the United States when it comes to maternal healthcare. So all that combined together accumulate to not a good outcome for especially women that may develop postpartum psychosis. So want to recognize that early, recognize what's going on with mom, giving her the support that she needs, and having open discussions about it. So that if we have any more questions, you're free to email me and or call me. I'm gonna give my information, of course, after these presentations. And thank you so much for listening to me. Again, with any questions, you will feel free to email me and I will get back to you as soon as possible. Thank you.